Hi, welcome to Bari Nation, where we support the bariatric community with humor, humility, and honesty.
You've just tuned into a podcast that welcomes you into a community, a resource center, and a safe place that powers your journey towards personal wellness.
Our goal is you leave us today feeling hopeful, inspired, and ready to live your best bariatric life.
Hello, Bari Nation. Welcome back to the podcast. Today, I have the honor of introducing you to one of our newest Bari Nation experts, Dr. Saurabh. Hello, Dr. Saurabh.
Hi.
We're so thankful that you are joining us as an expert and for today's conversation, because what we want to know from you are all of the benefits or the things that people can experience besides weight loss from undergoing metabolic and bariatric surgery. We think it's really important that people know weight is kind of secondary to the other things that are going on internally. And people might not realize all of the benefits that surgery can provide for them beyond weight. And we know this is a passion area of yours. So we're really excited to hear about those benefits from you, the expert ourselves. And the other person joining in on this conversation is the amazing Melanie Lindell. She is Bari Nation member, volunteer, leadership, all the things. Hi, Melanie.
Hi.
I know that both you and I, Melanie, have experienced huge benefits when it comes to things that we have reversed or stopped happening right in our bodies because of metabolic and bariatric surgery. So, Dr. Saurabh, will you introduce yourself a little bit to the people who have never met you before and then talk about the benefits of surgery?
So my name is Dr. Shireesh Saurabh. I'm a bariatric surgeon. I'm board certified in both general and bariatric surgery. I'm also board certified in obesity medicine. I've been in practice since 2014, so around 12 years now. And I practice in Seattle area. And I'm really passionate about treating obesity, not only by surgery, but also as a whole, using all the tools we have to, treat this complex medical problem.
You said something really interesting, and I'd like to clarify. So not only are you a board certified bariatric surgeon, but you're also certified in obesity medicine. What does that mean, and why is that important?
Initially, I was just a bariatric surgeon, but a few years back, with all these medications coming out, I got interested, and the best way was to learn more about it, take an exam so that I know more about it, and I can have a frank discussion with my patients about what are the treatment options we have, what is the pros and cons for each option. So that's why I took an interest in obesity medicine and got board certified in it. So I can basically do surgeries as well as prescribe medications for weight loss.
And I have to say, from my personal experience as a patient, and Melanie, maybe you can offer your insights too. When I first had my bariatric surgery 6 years ago, I didn't understand obesity was a disease, and I didn't understand there was even an obesity medicine, exam that you could take to become really an expert at this next level. Now that I know what I know, when I am meeting with people for my own personal care, I ask them if they have this certification in obesity medicine, because what that tells me is they understand this from a disease lens. And it is a very holistic approach to all of the facets of your life that obesity can impact. And somebody like Dr. Saurabh here has gone the extra 20 miles to ensure that he truly understands this disease from a much deeper perspective. And the care and the insight that you can get from somebody who is obesity medicine specialized is unparalleled. So it's something to look for.
Yeah, no, I think it's important to know all the aspects about obesity, because if you know more about the disease, then you can take care of it in a better way rather than just saying you're just going to have surgery or you're just going to do medicine. It's different patients have different goals and different conditions, so you can treat them appropriately.
Yep. Melanie, what has your care been like really working with an obesity medicine specialist?
Well, I mean, from the office I was with, I've had excellent care, and I know that is unfortunately more unique than many people. They either have someone that is not certified, or they only offer one kind of surgery, or their follow-up isn't ongoing. But when I met my surgeon, he said you're a patient for life. And so they have the holistic approach. They have the ongoing, annual checkups. My 6 years, coming up this next month. And, I'm getting ready for my giant blood panel. But even when I had to get a new primary care, I asked my new primary care specifically, what you're experiencing working with bariatric patients, right? Because even if they're not certified in obesity medicine, if you can't find someone like that, you should still interview anybody that's taken on your care, because they do need to look at through the lens. My hematologist has a fantastic understanding of bariatrics and all that. So he's like, your zinc and copper need to be checked as well. And just this extra layer. But my new primary care, what she said to me was, I feel comfortable taking care of you. It's not my primary specialty, but I worked with enough patients to feel confident to walk with you. And that gave me enough to sort of start the road of trust. And then, if lifes and things happen, you might need to maybe find someone that is, more special. But I think just asking the question, helps put people on notice that you need to look through a different lens when it comes to blood work and care for me and what treatment options may be needed because I'm a bariatric patient.
Well, and part of the reason that many of us go into bariatric surgery is that initial thing that we're looking for is weight loss, because we think what we're battling is our weight. It's a component, but sometimes it's not the only thing that we're battling. There are other issues that we really want to take care of. So what are those issues, or what are those things that we're fighting that metabolic and bariatric surgery can also help us tackle?
People call bariatric surgery as weight loss surgery, which is fine because, you do lose weight, but it's not the only thing. That's why it's known more as a metabolic bariatric surgery, because it helps with a lot of metabolic problems, which are a byproduct of being obese. So obesity as a disease leads to these metabolic diseases. So, there is a great chance after bariatric surgery to go in remission or have a better control over a lot of medical problems like diabetes, type 2 diabetes, high blood pressure, sleep apnea, cardiovascular disease, acid reflux. There's also risk reduction for cancer. The mental health improves, quality of life improves. And then there are a lot of non-scale victories you could have after bariatric surgery. I've had patients tell me about how they can sit in a booth in a restaurant, or when they go on a plane ride, they don't need extender seat belts. So, there are a lot of benefits and not just weight loss. And we can dive down into all the individual medical problems too, but I don't think there is a single surgery which provides so many benefits as compared to bariatric surgery.
We would agree with you. And if you're watching this episode, you're seeing Melanie and I, we're like bobbleheads. Yes. Because we ourselves have experienced all of these life-giving, life-changing, life-affirming things that have come into our life because we elected to undergo metabolic and bariatric surgery. And I want to call this out too. In Bari Nation and with all of our experts, we're working really hard to change the words that we say to ourselves. Because when I went in for surgery, and I think Melanie, you too, I called it weight loss surgery. But now I know, no, my surgery was about my sleep apnea. It was about my elevated cholesterol. It was about my elevated A1C. Those were the things that I was really after care and treatment for. And just like what you said, Dr. Saurabh, right? This surgery has the potential to help so many other things. There really isn't another procedure on the planet that can help you tackle so many different things with one procedure. Yeah. So, right. So let's take diabetes as an example. How does MBS, metabolic and bariatric surgery, help people treat the disease of diabetes along with the disease of obesity?
There's insulin resistance, which is very common. What happens with obesity? So what happens with insulin resistance is that your body needs to produce more insulin to overcome the cells, and then the blood glucose could enter your cells. So if you have insulin resistance, the blood glucose level goes up. So with insulin resistance, what happens is your pancreas starts working extra hard to produce more insulin. And then eventually your pancreas stops working and you get diabetes. And then you're put on medications for diabetes. And some of these are, something which can increase the weight, like insulin or other diabetes medication. And so you basically get into this vicious cycle of insulin resistance, diabetes, and obesity. And when you do the traditional form of treating of diabetes, you're basically just maintaining the blood glucose level, but not treating the underlying metabolic problem. So with bariatric surgery, what happens is there's hormonal changes. Your body starts producing this hormone GLP-1, which is what these medications are also on. So your body starts producing Ozempic and Mounjaro for you after bariatric surgery. And these hormones, they act on the pancreas and increases the insulin secretion and also improves insulin resistance. So that's why the diabetes is better controlled even before they start losing weight because of all these hormonal changes. A lot of the times my patients, the amount of medications they take for diabetes is reduced by half, or we have to completely stop it just after surgery before they go home.
Melanie, did you experience some other, these like cures, if you will, or treatment options once you underwent MBS?
Yeah, I mean, I think partly how I ended up in my surgeon's office was from my gastroenterologist, because I had a long, long history of severe GERD. And the base of my LES muscle, what do they call it? Lower esophageal sphincter muscle, I think is the actual name for it, had eroded. And so I was choking on everything, like everything would come back up. And so he initially sent me over to someone that, was looking at the fund application. And that guy said, first of all, you'd have to lose, I can't remember, it's called 70 pounds for me to do the surgery safely. And then he made a comment to me that was really sobering. He was, and here's the thing is, if you gain even like 5 pounds the rest of your life, you run the risk of it slipping and being a medical emergency. And so it was like stressful to think, oh my gosh, like it just, and so what he said, he goes, but there is a procedure that you could have done that would immediately correct that. And so I was only ever a candidate for gastric bypass, 1, because of my GERD, and 2, because of this muscle. And he said, and then you would also have the benefits of what it would do. Like my cholesterol, dropped, I was in that pre-diabetes, didn't have any medication for it. That went, significantly down blood pressure. So it like systemically, it changed all kinds of things before they reached sort of critical mass where I needed to onboard medications to treat it. So there was this nice little window that I was on my way to all of these things, needing, intervention. And this one procedure addressed multiple things. And one of them was immediate, like that rerouting. I no longer was choking on, and he said that would be day 1. That one would be gone for good. And that one has been true. So there is so much that it does, let alone life quality, let alone, just some of the, things like I just finished my first triathlon. Like there's a lot of adventure, that gets to come, things you maybe would have never considered, but systemically it hit all kinds of different parts of my whole well-being, almost immediately.
Yeah.
That's amazing. Yeah, that's really good.
It is one of the most powerful surgeries on the planet. And the wonderful news here is that if you have been struggling with excess weight or the disease of obesity for some time, now is the best time for you to seek out treatment. There has never been a time on this planet where surgery has been safer, where the medications are as effective, or when we have amazing experts like Dr. Saurabh, who's on our screen with us today, to help you treat it. So now is the time. And if you have already undergone surgery, but you're feeling disconnected from your surgical center, right? Or you're having other issues, it's time to reach back out and find that provider that is a perfect fit for you. So 3 things that I recommend that you do. In this show notes, you're going to see a link to Dr. Saurabh on Instagram. Go follow him and watch the amazing content that he produces almost every single day. The second thing that you're going to find down there is find an obesity provider guide that we've put together from Bari Nation. It's yours for free. Use it, maximize it. The third thing you can do is check out Bari Nation and the partnership that we have set up with this amazing doctor. If you're a patient of his, you're going to get membership at a discounted rate, which not everybody gets, and an ability to continue to learn from him and other experts. And once you start following on Instagram, once you listen or watch this episode, you're going to want to keep learning from him because he is not only amazing, but he's fun. And you just have a really great way of delivering this big education in very bite-sized, digestible chunks. So we very much appreciate that about what you do.
No, thank you, April. This is very kind of you to say that. But yeah, it's the way of transferring information has changed now. It's people have short memory span now, so attention span is also small. So that's why I try to keep it like one message at a time, one educational thing at a time. So that people can grasp it and keep it to themselves rather than, giving a 1-hour lecture about bariatric surgery. No one can follow through that. I would not do it myself.
No, you're onto something. You're onto something. This is why we're so excited to partner with you. Well, friends, we hope you enjoyed this episode, and we hope that you get to keep learning with us and Dr. Saurabh in Berry Nation. But until next time, we'll see you in the nation soon. Bye, friends.
Bye-bye.
Bye. That wraps up another empowering episode of the Berry Nation podcast. If you enjoyed today's episode, keep the conversation going by joining the Berry Nation membership community, where you can attend live support events, access on-demand resources, and find a caring community.
Join us at berrynation.mn.co. If you found this podcast valuable, help us produce it by becoming a $5 monthly supporter at berrynationpodcast.com.
And just remember, at the end of the day, you've got this, we've got you, and we'll see you next time. Bye, everybody.